In June 2014, the Darling Downs South West Queensland Medicare Local began planning for the creation of localised collaborative clinical pathways under a program named ClinicalLINKS.
Pathways have been around for about 30 years, and studies have shown that about 60 to 80% of hospital conditions are suitable for pathway use. Pathways have a number of advantages. The main advantage for our project has been collaboration and engagement between health professionals. Primary and secondary care all sit in the room together and decide the entire patient's journey in one map. And that's what ClinicalLINKS is. It's just an algorithm of best practice. They get together and they develop these amazing relationships, develop an agreed pathway forward, and when everyone uses it, the patient benefits. This improves referrals. It also means that patients have better outcomes.
ClinicalLINKS utilises an international software system called Map of Medicine to develop and support the pathways. It allows us to create flowchart-style pathways that tracks a patient's journeys through the health system in a specific area for each specific condition.
I think the ClinicalLINKS program has great potential to improve health outcomes for patients in the local community. It provides GPs and their patients with evidence-based best practice guidelines to assist them with the management of patients with many conditions.
So ClinicalLINKS draws on local expertise and skills, tends to build bridges, I think, between public and private, and it tends to foster a consensus approach to treatment where the various providers in the healthcare team agree on what's best practice. One of the benefits of ClinicalLINKS is that if it's about getting all of the health providers in the primary care team and indeed the patient all on the same page, then this is the page.
And if GPs use the guidelines to assist them with patient care, they can certainly be assured that they are providing the most appropriate care in the best pace possible.
Each of us might have a particular strength in providing care in one area, but it helps us to identify that the scope of our practice is limited as well, and so it tends to foster a multidisciplinary approach to management as well. And it's recognising that within our health community there are some people who are better suited to providing care in certain circumstances.
Developing the pathways for each region I think is really useful in that it enables GPs and patients and other health professionals in the region to know what services are available and how to access them. It's really useful for GPs new to the area and even GPs like myself who've been here a long time.
I think what ClinicalLINKS does is it helps to create a virtual team, a team that has the patient front and centre and particular health outcomes in mind.
For health professionals, it's free to use and it's very easy. It's a software package, so a GP and specialist would just log in, find the pathway they want by selecting the name or it's all listed. There's about 1,500 localised pathways that are available and 400 international pathways. It's very, very simple and we get a lot of feedback saying how easy it is. It's got local information and it can be updated instantaneously, so the information's always up to date.
ClinicalLINKS is scalable and more pathways will continue to be made where needed. Through these procedural pathways, ClinicalLINKS will support the optimisation of patient care by providing instant access to comprehensive, evidence-based local guidance and clinical decision support at the point of care. All general practice teams, pharmacies, hospital staff and other health professionals can now access ClinicalLINKS for free. To register for a training session or to sign up to view pathways, simply contact info@clinicallinks.com.au or visit clinicallinks.com.au.